Um, so I work with Sage Bionetics, as I mentioned, and today I'll just share some insights from the community that I manage, which is the AD Knowledge Portal community. I promise I will get to explaining what the AD Knowledge Portal community is, but first we'll give a brief overview of why this community is. It's been really hard to escape the failures in the field of Alzheimer's disease research. The scientific community has been really trying to solve this problem for decades now, and they're not really making a lot of progress. So clinically, the prevalence of Alzheimer's is expected to triple over the next 35 years, which means by 2050, 2045, 3.5 of us will have Alzheimer's. And this is where, of course, the AMP-AD Consortium is starting to intervene. So it's the Accelerating Medicines Partnership, a public-private partnership funded by the National Institute on Aging to bring pharmaceutical and academic researchers together to discover novel and clinically relevant therapeutic targets and to develop biomarkers to validate existing targets. And this consortium includes, there's 6 key academic teams that are working kind of in parallel to target discovery. And then there's teams that are pharmaceutical partners who help guide target nominations and different approaches to target validation. So this is where, if we have any questions of small molecule translatability, those kind of pharma partners might get involved. And this community is more than 250 researchers, started in 2015 and 2014. But these 250 researchers come together to contribute to this really rapid and broad sharing of data. And when I say rapid and broad, I mean rapid and broad sharing. This is the count of data files from the AD Knowledge Portal since its inception in late 2014, which is crazy. There's almost 100,000 data files with biosamples from more than 7,000 individuals and a plethora of omics data available. And this is great. A lot of data is great. If I have thousands, hundreds of thousands of puzzle pieces and I throw them at you, that solves a puzzle. As Pajal was saying, not quite. I have a lot of puzzle experience these days, and let me tell you, there's edge pieces and corner pieces and different colors and shapes, and there's a whole community around the different puzzle pieces. And with human data, right, it's even more complicated. Not even touching on HIPAA, structured metadata for these individual human files needs rules. So if a data contributor provides a column indicating the sex of a biosample and they're using zeros and ones, that won't play very well if everybody else is using male and female. That'll be a problem. It won't be seamless to kind of cross-reference one data set with another. And that's one of the common errors that we see when collaborators contribute data, is consistency of data entry, both within studies, but also across different studies. So for example, if cell type includes an annotation monocyte, for example, and another data set is calling it monocytes with an S, suddenly it isn't easy, it isn't seamless to search and filter across studies. Completeness is another really common but crippling error when cells are left blank or there's unexpected columns. It's like throwing a puzzle piece in from a completely different box. And then accuracy errors can refer to protocol, cross-referencing, precision measurements, that kind of thing. So it seems overwhelming. It seems like a lot to work out. And we use a tool called the DCC Validator. This is a Shiny app that lets contributors check if the data files that they're uploading follow the rules of the metadata, and it will upload complete data to a known location, which cuts back a lot on the back and forth between data contributors and data curators. And so what happens is you upload a file and you get these checks, these green successes and orange warnings, which might be an issue, but that's at the discretion of the researcher. Things like if you tracked education level, these cells are blank, but maybe you didn't track it in your study, so that's okay. And then there's failures, things that won't play nicely with other data sets. If any columns are missing or values are invalid, they'll be called out and highlighted for ease of immediate correction. And this is just a quick demo of that. Ooh, look at all that. Wow, so fast, so easy. But data is just one piece of the puzzle. It helps to have this tool, but we're not just here to talk about data. We're also here to talk about people. And I think I mentioned already the 250 collaborators in the AD Knowledge Portal community. This is page 1 of 10, and there may or may not be a glitch in the matrix here. See if you can find it. Community challenges are way more complex than those data challenges because people have goals and cultures and unique experiences. So some common challenges, did anyone notice the matrix glitch? This guy, David Bennett, there's 2 of him. Hey, there it is. So a couple different common challenges that I've noticed are language, resources, and goals. And by language barriers, I don't necessarily mean R and Python or English and Spanish, but communication channels that might leave some people out or lack accessibility. So if you're using email or Slack, if your webinars have subtitles or not, those kinds of considerations have multiple potential solutions. Sharing resources, by this I mean not only the data itself and the data sets, but sharing access to funding and tools, to analytical tools that folks might develop, and they might be more or less motivated to share for different reasons. If they're afraid of getting scooped or potentially being misrepresented in a publication. And setting mutual goals, finally, is really important too. I found the most effective way to do that is to come together physically when possible, but virtually is what we have right now. And coming together in working groups or in these meetings or symposia, this allows folks to get together and co-author manuscripts or apply for grants together, things like that. And so if we bring these together, these 3 obstacles, speaking the same language when it's possible or translating when you need to, sharing resources when that's possible, and setting goals or aligning objectives so you can make sure you're headed in the same direction. So combining those community challenges with the data challenges I talked about earlier, we can start to visualize this pyramid of sort of collaborative scientific efforts with raw and consistent data at the bottom with that data quality and meta standard quality. That's the foundation. Scientific communities are built, among other things, on trust, and trust is built with shared goals and I guess also vulnerability, but that's Brene Brown. That's a whole other TED talk that I don't have time for. And the community trust, this data is what generates these co-developed algorithms and tools, and those are what ultimately give rise to the top of the pyramid, to therapeutic targets and molecular possibilities for a potentially transformative breakthrough in Alzheimer's research. And with that, I'd like to thank my amazing team of collaborators and workers at Sage Bionetworks. I'll also leave up this convenient Twitter handle because we're hilarious and this vast audience would certainly appreciate following us. With that, I'll stop sharing.